Hello? Hello? So, hello everyone. Thank you for joining us today. We have a very interesting case I want to show you because this is very important, right? Um, Many times, many people has been asking me about varicelography previously doing US guided coil or cyanoacrylate injection or together, right? And in many of my lectures that I has been performing during the last few years, I has been showing that the risk is low, but there is still a risk. And when we start to do this technique about varicelography, US guided varicelography, when we start to do it, we start to see some cases that have shunt. So today we have a patient. ¿Cuántos años tiene? I am here with Dr. Raquel del Valle, the biggest one in US elastography and DFI. 78 years old woman that we previously treated 2 years ago with coils and cyanoacrylate injection because of liver cirrhosis. But this patient has not been taking her beta blockers. So she came because of reappearance of a gastric varice. It's a really small gastric varice, to be honest. But we need to understand what are the risk factors to coming back, to why this kind of patient can reappear, the gastric varices, because in the 8 years follow-up, nowadays we know that the risk is very low. It's less than 10%, to be honest. And why this can happen? So there are several factors. One of them is that you didn't view that there were other feeder vessels. That is one of the first one, right? In this case, I don't believe, because the patient was doing follow-up and she didn't have any gastric varice. Second, that the patient is not taking beta blockers. We know now by our study that when they didn't take it, the risk of reappearance in the time it is, but the patients that take beta blockers, they didn't reappear after 8 years, after even 5 years. Okay, so there is a risk. There is a second risk, and third, any kind of situation that can increase the portal hypertension. So what we see in this patient, I will show you today, we have a mass in the liver. So probably she's doing hepatocarcinoma. So we will take a biopsy just to confirm that first. And second, is a big mass, huh? And second, okay, so we need to understand how is the vessels and the flow. Okay, so now I am here. You can see, quiero la imagen, I am inside the vessel, correct? I was just doing my job today. But I want to show you en grande la imagen de radioscopía, de fluoroscopía. The fluoroscopy image in big, and you will see here. Now I will use contrast because I want to show you, and I want that you see very well. I am inside the vessel. I am putting contrast. You can see here how this feeder vessel is coming here to the left gastric vein, but more contrast. Más contraste. But there is a shunt here. You see? Oh, very well. So this case is very, I think it's very clear, the shunt, so that's why when we don't use varicelography, when we don't perform a correct examination, and that's why I believe varicelography needs to be a standard of care before to do whatever kind of therapeutic with glue. So, well, now there is a shunt here, okay? I will show you again, más, por favor. And I will not use glue. And that's why in our series, we doesn't have any kind of problems with embolies or anything. Okay, so now, Salina. Once again. So very good. So now I will use just a coil. I have a 40 millimeter coils, and that is only the only therapeutic that I will do, and I will perform in this patient. Okay. So me puedes mostrar la imagen de la eco en grande, por favor. Sigue. Okay. So it's very important what I am trying to show you. So I will just put a coil. Finish. That's all. I will not use the glue, and I will, insist in this patient to take the beta blockers to avoid, reappearance. Now I am very sure that there is not more flow. So now I am sure I use a big coil, bigger than the Varices, because I need to stop the flow. And now I believe I do it, okay? So now I will show you. Where's Now I will show you a little bit the liver. So here's the mass. I will take a biopsy now. So we are doing now endopathology, right? So Dr. Raquel was doing a lot of very interesting things with DF5 that is available in the Aloca 850 from Fuji or Itachi. Well, I don't know. And we have also, I am taking a liver biopsy now from the lesion, right? Menos presión, por favor. No, menos presión. Menos. 5. Okay. So I am using a Boston Scientific standard needle. I like it. Even much better than the new one. And I use the same needle in this case because I was inside the vessel, right? And now I am taking just a biopsy to confirm if our hypothesis is correct. We will make also serum markers. It means alpha fetoprotein we need to measure in this patient, okay? So I just wanted to show you the shunt, I believe, and what to do in those cases. So that is very important because I believe we change the way that we treat this patient with gastric varices and portal hypertension due to liver cirrhosis. So if you have any question, please do your question, text us. Well, it appears that we have a very good tissue now. Okay. We have good tissue, right? So this is not FMB. This is an FNA, a standard Boston Scientific needle. So my friend Mike Jones, look, this is good, huh? ¿Podemos ver la muestra o no? Well, I don't know if we can see them. Enfocarla está difícil, huh? To focus is a little bit difficult, huh? It's some bloody, but it's okay, huh? It's a very good sample, big sample. So, so Mike, the needle passed the test. Okay, so I finished. I will pass just the gastroscope to see if everything is okay. And during we are waiting, I will show you a little bit the results of this is this is yes, yes, this is the no, me olvidé el nombre. No, this is the Sharewave technology. I'm sorry. This is the measure that Raquel take it. You can see, no, la ecografía, hijo. ¿Qué haces con la imagen allá? Quiero ver la imagen ecográfica. Ah, es porque me sacaste el endoscopio. Conecta el ultrasonido. I'm sorry, my assistant was not helping me. Well, Milena. Okay, so you can see here, I will put in big. You can see here the measure of the lesion that we find out. So the elasticity is 12, is high. I will try to review the other measures that we have. So now we are conducting a study to evaluate DFI as a technology for, you know, for predict liver disease, or, you know, in patients with metabolic issues, right? Like or any other issues, you know, when we have inflammation or something like that. This is the spleen, right? So I will show you. So you see the elasticity is very high. This is because there is a high portal pressure. So we demonstrated that in a previous study, right? ¿Cuáles fueron los resultados del estudio anterior? She do it, but she doesn't remember. No, the results is that normally is less than the elasticity normally is less than 10, and here is 38, so it's very high. It means that there is a lot of portal hypertension now. So probably it's because of the tumor, and that's why you know the blood pressure is high now. But it's very interesting. You know, this is what I said. This is the future of endoscopy. You know, of endohepatology, right? It's like there's no more. Más imágenes, no? This is all the image. So we were still working on this. This is part of the future now. I believe we'll have very good results, and probably in the future we can do some kind of treatment with this kind of lesions, for example. But also we are trying to looking for a little bit, you know, the lesions, how they are, and also in, you know, in inflammation. So we are trying to see by using AI if we can predict, you know, the lesions or the disease, inflammatory disease inside the liver and other areas as pancreas. So now I will try to see how is going on after the treatment that I do it. So you can see here. So it's very well. So now I can see where was the bleeding here. You see? And now this is the result that we have. So that will disappear in 24 hours, okay? So I finished. Thank you so much. So see you soon. Bye bye.